Hello and welcome. My name is Kush and this is Kush Knows. On this week's episode, we're going to be talking about cancer, cannabis, and cannabinoids. Check it out. Marijuana is a plant which contains a compound called cannabinoids. We know that some of these cannabinoids are psychoactive, which means they can alter a person's mood or level of consciousness. The primary active ingredient is tetrahydrocannabinol or THC. More often than not, it is used recreationally. THC is a psychoactive drug that is capable of heightening mood, relaxation, and increasing appetite. Generally, the public knows this as getting high. Right now, cannabis is banned in most countries around the world, some of which include the Netherlands, Spain, Switzerland, and some parts of the United States. Today, we're going to take to the streets and ask around to see what the general public knows about marijuana. Let's roll out. So when we talk about cannabis, what's the first thing that comes to your mind?
It's illegal.
And how much do you know about it?
Not much.
Not much at all?
Not much at all.
No?
I know it gets you high.
So when we talk about cannabis, what's the first thing that comes to mind?
Hippies.
Yeah.
It's quite demotivational.
Yep. And what else do you know about it?
It's legal in Colorado and can be used for hemp, like shirts and stuff.
It's quite prominent. It's quite common that people do it in any sort of situations.
As seen in the interviews, we can assume that the general public know enough about the recreational side of cannabis. But what about its therapeutic effects? Today, we're going to discuss the other side of the story with my good friend, Dr. Nguyen. Thank you for joining us. You have a PhD majoring in oncology. Can you tell us more about medicinal marijuana and how it helps with cancer?
Yeah, so as you said before, most people know cannabis as a drug used for recreational purposes. However, what you may not know is that it can also be used therapeutically. Marijuana can be used as an analgesic to relieve pain or to help stop nausea and vomiting. But most interestingly, it can be used to help treat cancer. Studies have shown that cannabinoids have anti-inflammatory effects and can inhibit cancerous growth such as tumors. First of all, cancer is an uncontrollable proliferation of cells. What this means is that the cells divide and increase rapidly by inhibiting certain anti-growth factors, such as cyclin-dependent kinases, or CDKs. The cannabinoids found in cannabis act on the CB1 and CB2 receptors in the cell signaling pathway. This downregulates the DNA binding inhibitor, which decreases the expression of tumor growth, and in turn inhibits metastasis of cancer cells. The protein ID1 is also downregulated, which reduces angiogenesis via the extracellular signaling pathway. It is known that the ID1 gene is responsible for causing a high rate of cell proliferation. Cannabinoids can also cause a form of autophagy proteins to kill cancer cells. It does this by closing off outer mitochondrial pathways. This reduces the electrical potential of the cell, which causes an increase in membrane permeability, eventually resulting in necrosis. However, this form of apoptosis is only effective in fighting tumor growth.
Thank you, Dr. Nguyen. We're now going to take a quick break, and when we come back, I'll be following up with the public's opinion on the ethical issues regarding legalized cannabis. So, in California, they've legalized medicinal marijuana for cancer treatments, and they're in the process in Victoria. Would you support medicinal marijuana for cancer treatments in New South Wales?
Depends. If it works, then sure. But, if it doesn't, it doesn't.
I agree. Yeah, it's like if it actually does something, well then yeah, it's like it's kind of stupid not to be like say no. I guess. So yeah, I agree if it works.
Welcome back. Let's get started. A few of our interviewees brought up some strong concerns regarding the ethics behind medicinal marijuana. We go back to Dr. Nguyen with some critical questions in the hopes that he can answer them. Is the chronic use of marijuana during treatment going to cause an addiction?
Unfortunately, just like any other recreational drug, medicinal marijuana has the potential to be abused. The pathways involved with addiction for other drugs, such as MDMA, are also present in marijuana. However, the dosages prescribed are low and controlled.
Should we be wary of the side effects of marijuana while undergoing treatments such as paranoia?
The adverse side effects, such as paranoia, are typically not pronounced with medical marijuana. However, in saying that, it is definitely possible, just a low chance.
Does it have the potential to be misused?
The medicinal marijuana will be controlled and prescribed by a doctor. As such, it should not be possible for cannabis to be abused.
Do you think the less fortunate can afford treatment?
Unfortunately, this depends on the state of your healthcare and whether medicinal marijuana will fall under it. In Victoria, Australia, it is currently being discussed whether it will be categorized under Medicare or not.
Well, that ends this week's episode of Kush Knows. I hope you've enjoyed it, and until next time, it's bye for now.
Smoke weed every day.